Healthcare assistant roles are indispensable in the medical field. As a prospective candidate, knowing how to effectively respond to interview questions can significantly boost your chances of success. This video is designed to provide you with insights into the top 25 interview questions for healthcare assistants, and most importantly, how to answer them. 1. Tell me about yourself and why you're interested in becoming a healthcare assistant. I am a compassionate and dedicated individual with a passion for assisting those in need. I have always been drawn to the healthcare field because of its potential to make a significant impact on people's lives. The role of a healthcare assistant appeals to me specifically because it involves direct patient care and offers the opportunity to build relationships with patients. I believe that my ability to empathize with patients, my attention to detail, and my commitment to providing high-quality care make me a strong candidate for this position. I am eager to contribute to a team that values patient-centered care and am ready to take on the challenges this role presents. 2. What inspired you to pursue a career in healthcare? Working in the healthcare industry has always been a dream of mine. From a young age, I was inspired by the compassion and dedication of healthcare professionals in my life. Their ability to make a difference, not only in the lives of their patients but also in their communities, deeply moved me. I saw firsthand the impact they made, and I knew I wanted to be part of that. I believe that as a healthcare assistant, I can bring comfort and care to those who need it the most. This thought fuels my passion and dedication to pursue a career in healthcare. I am eager to use my skills and knowledge to contribute positively to the lives of my patients. 3. What do you think are the most important qualities for a healthcare assistant to possess? The most essential qualities for a healthcare assistant include empathy, patience, and communication skills. Empathy is necessary as it allows one to understand and relate to a patient's feelings or hardships, facilitating a supportive and comforting environment. Patience is vital as dealing with patients, especially those in pain or distress, may require time and resilience. Lastly, communication is key in the healthcare industry. A healthcare assistant must be able to effectively communicate with patients, their families, and other healthcare professionals to ensure accurate information exchange and seamless patient care. Additional qualities include physical endurance, adaptability, and attention to detail. A healthcare assistant often has to be on their feet and perform physical tasks like lifting or moving patients. They should be adaptable to handle a variety of situations and patient needs. Attention to detail is also crucial to correctly follow care protocols and notice any changes in a patient's condition. 4. How do you stay updated on best practices and developments in healthcare? I consistently stay updated on best practices and developments in healthcare by subscribing to various healthcare journals and magazines. I also attend workshops, seminars, and training programs whenever possible. Additionally, I actively participate in online health forums and communities, where I can interact with other healthcare professionals and learn from their experiences. I believe it's important to stay informed about the latest trends, research findings, and advancements in the healthcare field to provide the best possible care to patients. 5. What experience do you have working in healthcare settings? As a healthcare assistant for the past 4 years, I've worked in various settings. I initially started in a large hospital, aiding in different departments such as geriatrics and emergency. This gave me a broad understanding of different specialties and requirements. I then transitioned to a smaller, community-focused clinic, where I learned the importance of personalized care. Most recently, I've been working in a home care setting, providing assistance to elderly individuals in their homes. This diverse experience has allowed me to adapt to varying patient needs and working environments. 6. Can you describe your experience with taking vital signs and recording patient information? My previous roles have provided me numerous occasions to take vital signs and record patient information. One of my main duties was to routinely monitor and record patients' vital signs, which include pulse, temperature, blood pressure, and respiratory rate. I am accustomed with the use of medical equipment like a stethoscope, blood pressure monitor, and thermometer. I have also been responsible for recording this data in patients' health records with high accuracy. I always ensure that my documentation is precise and up to date, as it can be crucial for doctors to make informed decisions about treatment plans. 7. How comfortable are you with assisting patients with activities of daily living, such as bathing and dressing? I am very comfortable assisting patients with their daily activities. I understand that as a healthcare assistant, it is part of my responsibility to aid patients in tasks they might find difficult due to their health conditions. I approach this aspect of my job with a great deal of empathy and respect for the patient's dignity. I have experience in helping patients with bathing, dressing, eating, and other personal tasks. I always ensure to provide assistance in a manner that is sensitive to the patient's comfort and personal boundaries. 8. What is your approach to maintaining patient confidentiality and adhering to HIPAA regulations? As a healthcare professional, it is my utmost duty to maintain patient confidentiality. I strictly adhere to HIPAA regulations by ensuring that any information related to a patient's medical history, treatment plan, and personal data remains confidential. I only share such information with authorized personnel. I employ secure methods of documentation and communication and constantly stay aware of the latest updates to HIPAA regulations. I believe trust is crucial in the healthcare field, and maintaining confidentiality is a key aspect of building that trust. 9. How would you handle a situation where a patient refuses care or medication? Understanding the patient's point of view is crucial in such scenarios. I would calmly explain the necessity and benefits of the care or medication, using simple, non-medical terms. If the patient is still adamant, I would inform my supervisor or the relevant healthcare professional, ensuring their health isn't compromised. I believe it's pivotal to maintain calm and patience, as forcing care or medication might lead to distress and fear. Respecting the patient's autonomy while ensuring their health and safety is a delicate balance that needs to be maintained. 10. Can you give an example of how you've dealt with a difficult or agitated patient in the past? Working in healthcare inevitably involves dealing with difficult or agitated patients. For instance, I recall dealing with a patient who refused to take medication due to fear and anxiety. I didn't rush or force him. Instead, I calmly explained the importance of the medication for his recovery, acknowledging his fears and reassuring him. This patient-centric approach helped the patient to relax and comply. It's imperative to remain patient, empathetic, and communicative when dealing with such situations. 11. Describe your experience with medical terminology and documentation. I have gained extensive experience with medical terminology and documentation during my time working in different healthcare settings. My previous role involved a lot of administrative work, which included updating patient records, writing reports, and maintaining clear communication with other members of the healthcare team. I have a good understanding of medical terminology, which I believe is crucial for accuracy in healthcare. I am also well versed in using electronic health record systems, which are increasingly becoming the norm in many healthcare facilities. I understand the importance of accurate and timely documentation in providing quality patient care and in ensuring seamless communication within the healthcare team. My goal is always to ensure that all documentation is completed thoroughly and accurately, respecting patient confidentiality at all times. 12. How do you approach working as part of a healthcare team? In any healthcare setting, teamwork is essential. The ability to work cohesively with a diverse group of professionals such as doctors, nurses, and other healthcare assistants can greatly improve the quality of patient care. In my previous role, I made it a point to foster open communication among my teammates. I believe that by sharing ideas and discussing patient care plans, we can all contribute to the overall goal of providing excellent healthcare. I also respect the expertise and opinions of my colleagues, which helps in creating a harmonious work environment. This approach not only aids in the smooth functioning of our team but also ensures that we work in the best interest of our patients. 13. Can you give an example of a time when you had to communicate sensitive information to a patient or their family? Sensitive communication is a crucial skill in healthcare. I remember a situation where a patient was diagnosed with a serious condition. I had to convey this information to the patient's family. It was important to be compassionate and patient, offering reassurance and support while sharing the facts clearly. I ensured they understood the condition, the treatment plan, and any potential complications. I answered all their questions and directed them to further support and information as needed. This approach is vital in maintaining trust and transparency between healthcare providers and patients. 14. How would you handle a disagreement with a coworker about patient care? In my experience, disagreements can often lead to positive outcomes if handled correctly. In a situation where I disagree with a coworker about patient care, I would first aim to understand their perspective by having an open and respectful conversation. I believe it's essential for all staff to be on the same page to provide the best care for our patients. If we are unable to resolve the disagreement, I would seek advice from a superior or consult established guidelines or protocols. This way, we can ensure that the patient's well-being is always our primary concern. 15. Describe a situation where you had to prioritize multiple tasks. How did you manage your time effectively? In my previous role as a healthcare assistant, I was often faced with multiple tasks that needed to be completed within short timeframes. One such instance was when I had to prepare several patients for surgery, administer medication, and document patient information simultaneously. To manage my time effectively, I used the strategy of task prioritization, allocating the most immediate and critical tasks first, such as preparing patients for surgery. Next, I moved on to the important, but less immediate tasks such as administering medication. Finally, I focused on tasks that could be completed in between the others, like documenting patient information. In situations where tasks became overwhelming, I wasn't hesitant to seek help from my colleagues. This approach not only ensured that all tasks were completed on time, but also that the quality of care provided to the patients was not compromised. 16. What steps do you take to ensure safe working environment for yourself and your patients? In my line of work, safety is paramount. I start by adhering to all guidelines and protocols set by the healthcare facility. I wear protective gear, such as gloves and masks, when necessary to prevent the spread of infections. Regular hand washing and sanitizing is also a part of my routine. For patient safety, I always double-check identification before administering any medication or procedure. I also ensure that all equipment is in good working order before using it. I report any hazards or potential risks immediately to my supervisor. In addition, I promote a culture of safety by continuously educating myself and staying updated on the latest safety practices in healthcare. 17. How would you respond if you witnessed a patient fall? I would take immediate steps to ensure the patient's safety. First, I would carefully assess the patient for injuries. If necessary, I would call for medical assistance while trying to reassure the patient and keep them calm. I would document the incident and report it to the relevant medical personnel, as well as inform the patient's family. It's important to take falls very seriously as they can have serious implications, particularly for older patients. I would also review the circumstances leading up to the fall to identify any potential risk factors that could be addressed to prevent future falls. 18. Describe your experience with infection control procedures. My experience with infection control procedures is comprehensive. I understand that maintaining a sterile environment is crucial in healthcare settings to prevent the spread of diseases. I am familiar with standard precautions like hand hygiene, the use of personal protective equipment, PPE, safe injection practices, safe handling of potentially contaminated equipment or surfaces in the patient environment, and respiratory hygiene, cough etiquette. I also have experience with transmission-based precautions such as contact, droplet, and airborne precautions. I strictly adhere to these protocols to ensure the safety of patients, myself, and my coworkers. I am also responsible for educating patients about these protocols when necessary. 19. What would you do if you noticed signs of abuse or neglect in a patient? As a healthcare assistant, my first responsibility is towards the patient's well-being. If I noticed signs of abuse or neglect, my immediate action would be to document the signs and symptoms I observed. This record would include physical indications, emotional behavior, or any verbal disclosure made by the patient. I would promptly report this to my immediate supervisor or the designated safeguarding officer within the healthcare setting, following the organization's protocol for such situations. Patient safety is paramount, and it's crucial to ensure that such concerns are addressed swiftly and appropriately. 20. How do you build rapport and trust with patients? Building rapport and trust with patients is achieved through consistent communication, demonstrating empathy, and showing respect for their needs and concerns. I make it a point to listen attentively, understand their feelings, and reassure them that their well-being is my primary concern. I ensure that I explain medical procedures and their benefits clearly, eliminating fears or doubts. I believe transparency fosters trust. Also, I maintain a professional demeanor and respect their privacy, which further strengthens our relationship. Regular interaction and showing genuine care for patients help to build rapport and trust. 21. Can you give an example of how you've provided emotional support to a patient or their family? As a healthcare assistant, I've had numerous opportunities to provide emotional support to my patients and their families. For instance, I once cared for an elderly gentleman who was dealing with the progression of a debilitating disease. His family seemed overwhelmed by the situation. I made sure to always have a calm and compassionate demeanor around them. I often spent time simply talking with the patient and his family, reassuring them and giving them a listening ear when they needed to vent or express their fears. I also helped them understand the disease and what to expect, which seemed to put their minds at ease, even if just a little. 22. How do you maintain a positive attitude when dealing with challenging patients or situations? Maintaining a positive attitude in challenging situations involves a lot of patience, empathy, and understanding. I make it a point to always empathize with the patient, understand their perspective, and reassure them that I'm there to help. I try to keep my cool, even in stressful situations, because I understand that my mood and demeanor can greatly affect the patient's experience. I also practice self-care and stress management techniques to ensure that I am mentally and emotionally equipped to handle these situations. In difficult times, I remind myself of why I chose this profession, which is to provide care and make a meaningful difference in people's lives. 23. What are your long-term career goals in healthcare? It's my aspiration to continually grow my skills and knowledge in the healthcare sector. I aim to progress into more senior roles over time, such as a senior healthcare assistant or a nurse, where I can have a greater impact on patient care. I am also interested in areas of healthcare that focus on prevention and education, so I may explore opportunities in these areas as well. I am committed to lifelong learning and plan to take any relevant courses or certifications that would enhance my skills and allow me to provide the best care to the patients. 24. How do you handle constructive criticism and feedback about your work? I believe that constructive criticism and feedback are essential for my professional growth. They help me identify areas for improvement and work on them to enhance my skills and performance. When I receive feedback, I appreciate it, regardless of whether it is positive or negative. I consider it a learning opportunity and take it seriously. I reflect on it and try to understand what I can do better. I am not afraid to ask for clarification if there is something I do not understand. I then make an action plan to address the areas pointed out in the feedback. I continuously strive to improve and develop my abilities as a healthcare assistant. 25. Are you willing to pursue additional certifications or training to enhance your skills as a healthcare assistant? Yes, I am certainly open to pursuing additional certifications or training. As a healthcare professional, I understand the importance of continuous learning and staying updated with the latest practices. This not just enhances my skills but also ensures that I provide the best care for my patients. In the past, I have taken extra courses and attended workshops related to healthcare. So, I am more than willing to continue this practice in order to improve my expertise and provide the best service. I believe that the more knowledge and skills I acquire, the better care I will be able to provide to my patients. We sincerely hope our video has been informative and beneficial to your preparation. If you appreciated our content, please hit the like button and subscribe to our channel for more insightful guides and tips. Best of luck with your interview.